What do clinicians need to ensure the transition to the role of advanced practitioner is a successful one? That was the title of the study that we conducted, myself, Emma Mellors and Clare Butler at Oxford Brookes University. On conducting a literature review, we found that the existing literature highlights the challenges clinicians face when transitioning into advanced practice roles. Narrative reviews exist and many qualitative studies that identify the barriers and propose facilitators around transition, whilst policy documents offer strategic guidance to support transition. However, qualitative studies that directly explore the clinician's perception of their own needs during early stage transition remain limited. And certainly, allied health professionals are underrepresented in the evidence base. And we also found that current studies rarely address practitioners' needs equitably across the four pillars of advanced practice. Often there is a focus on transition for the clinical pillar rather than leadership or education or research. So the aim of our research study was to gain a deeper understanding of the individual and shared needs of a multidisciplinary cohort of clinicians in the first year of an MSc Advanced Clinical Practice program. And we did this at Oxford Brookes, and we gained ethical approval to do this study. So in doing so, we were able to conduct the first multidisciplinary study to directly ask clinicians, what is it that you need to ensure that your transition is a successful one? The methods used, we undertook a qualitative study design incorporating a participatory video approach, and this enabled the use of students' own recordings in responding to the question, the research question, what do you need to ensure your transition to the role of advanced practice is a successful one? We also used purposive sampling, so we did this through recruiting students through a module in the first year of the Advanced Clinical Practice program. And what we were looking to do was recruit a sample that was representative of the interdisciplinary cohort on the module itself. And then once we did recruit students and we had the data, we used a live coding process. So that wasn't transcribing the data, that was watching and rewatching, taking notes and making codes and pulling out key quotes as we watched. And then we followed a thematic analysis process. And this was used to organize the coded data into themes. So in terms of findings, we found 7 themes that emerged from the accounts of a total of 19 clinicians who were recruited and gave informed consent for the study itself. So those themes can be seen on the graph on the right. They are listed there according to how many participants named them in terms of emerging from their accounts. So professional development as a theme was the biggest one across all the participants. Then support, then role clarity, role exposure, research opportunities, leadership and management opportunities, and a 4-pillar approach being the smallest theme that emerged, with 6 participants discussing issues that emerged within that theme. So within each of the main overarching themes, there were sub-themes, and we use the sub-themes to help, through an iterative process, build the main theme titles. So, for example, just let me give a little bit more information. So professional development, for example, that includes sub-themes such as the need for formal courses, CPD and learning culture, developing non-technical skills, having protected time for education, Also developing others, so not just about their own professional development, but about the professional development of others. There was also a link made to quality improvement within this, informal on-the-job training, and learning from colleagues in the MDT. Support encompassed support from a range of colleagues, so including senior as well as peer and across the MDT. This included feedback, appraisal, space for planning and development, and again talked about culture, support within the organisational culture. Role clarity, that encompassed sub-themes of expectations and boundaries, transition plan, clear communication, defining professional identity, clear reporting structure, as well as more practical considerations. Role exposure, that included interprofessional and collaborative working, so how clinicians felt that they were readied for that. Also exposure to speciality needs and given supernumerary time, how much autonomy they felt they had and ability to deal with complexity. Research opportunities were about needing to be exposed to QI projects or research involvement, gaining the knowledge and developing understanding, as well as having allocated time and support for that. Leadership and management opportunities are about having the optimal opportunity to be involved and develop this. Developing the skills themselves through also service development and strategic involvement. And a 4-pillar approach, that theme encompassed sub-themes of balance between the 4 pillars as well as the opportunities across them, and also a focus sometimes on the clinical pillar itself. Now, once we come up with those themes, we did look at the 4 pillars of advanced practice, and we kind of analysed how that fitted into the themes. There was clear overlap in terms of similarity between the pillars and the themes, but the 4 pillars themselves were not the themes. But what we found we could do was we could map the capabilities in each of the pillars to the relevant themes that we'd found. So, for example, we found that under the clinical practice pillar, the capabilities there very much alluded to the theme of role exposure, role clarity, and support that the clinicians said they needed. Within leadership management pillar and capabilities there, we found that directly related to the leadership and management opportunities that clinicians needed. Within the education pillar, that mapped very well to the professional development theme, and the research pillar mapped again to the research opportunities theme. So in terms of conclusions and recommendations, clinicians require support in achieving balanced development across the 4 pillars, alongside structured professional development, role exposure, and role clarity. There are challenges of transition and persistence of these unmet needs, so it's really important to come up with realistic solutions to address both practitioner requirements and service demands to enhance patient care. Certainly, the voices and needs of transitioning advanced practitioners really warrant greater representation in the literature. It should be contextualised with an established framework such as the 4 pillars to support the transition in a realistic way and a clear, transparent way. Adopting a clear and multi-professional approach to the research would strengthen the diversity of it and the representation and contribute to a more inclusive body of advanced practice literature. For educators specifically from this, the recommendations are that educational programs should formally integrate content within the first year to address challenges of transition and support clinicians in critically examining their own development needs and ensure that balanced preparation for transition is done across the 4 pillars. There's a QR code there to the reference list. Thank you for listening, and do get in contact if you have any questions or queries at all. My email is emellors@brookes.ac.uk. Thank you for listening.